All right, welcome Amy, a Harvard graduate, but struggled to figure out her headphones on Zoom.
Yeah,
Right?
it took. I'm also a former audio engineer, which is also what's embarrassing about it. But
I'm like user error, or maybe Zoom just had. You're not the first person that's
yeah,
struggled to do that, but I thought
yeah,
I was saying it, but you weren't hearing me. I was like, oh, you can graduate Harvard, but Zoom got her today. I like those
yeah.
headphones though.
Thank you. Thanks a lot.
So I wanted to talk to you because you are involved in CrossFit Health, but being a physician, and I'll let you kind of explain your degree. I think we all see the MD and we're just like, she's a doctor, she's smart, she knows what she's
Hmm.
talking about,
Yeah, sometimes, yeah.
which is great, which is great. But I think right now it's a great opportunity to dive into what's happening in CrossFit and your
Hmm.
involvement there. I think
Yeah.
it's phenomenal, of course. I think we're changing the world, but I'm
Hmm.
anxious to hear from a doctor's perspective because correct me if I'm wrong, there's still a lot of obstacles when it comes to entering the world of medicine.
Yeah, as far as CrossFit entering the world of medicine, certainly I think we haven't necessarily got to the point where physicians and people in the public realize that CrossFit is for everybody and can be accessed by everybody. And that's been one of one of the goals of the CrossFit Health movement is to show that it can benefit anyone, and that it could also be an effective tool in fighting chronic disease, which at the end of the day is what is killing people. Hundreds of years ago it was infectious diseases and things like that, and now it's chronic disease, diabetes, obesity, hypertension, things like that are totally preventable via lifestyle choices, but still they still plague us. It's a huge cost of healthcare dollars. It's a huge cost of time, money, energy, and it could be a simple fix, just getting people to the box.
So if 100% of doctors bought in, say that's
Mm-hmm.
100%,
Okay.
every doctor in the let's go country, right? Every doctor
Okay.
in the
All right.
country,
Mm-hmm.
what percentage are currently bought in right now?
Oh boy. It's more that I think if you would have asked me that maybe a year ago, I would have said
Like 1%
one
maybe,
percent of
if that,
us.
right?
I
Yeah.
think it's expanding, and it's also the kind of thing that it's less of a taboo to talk about. I initially, when I first started working in Boston, you know, almost 10 years ago, I mentioned CrossFit, and I got a lot of naysayers in the medical community. And I think over the 10 years I was there, that started to change as more people started to, as I talked about it more, and people started realizing, getting out there and trying it for themselves. I think that is turning. It's not exactly turned yet, but so I'd say maybe it was 1% before, and now maybe we're like 5 to 10%. There's a big cohort of us now that are involved in the CrossFit Health thing and
So you
the
think,
MDL ones.
I mean,
Yeah.
based on that, you think really if we saw 10 doctors, we crossed paths with 10 doctors, one out of every 10 would be, hey, I like CrossFit?
I
What is
would
that?
say I don't know if I'd even say it's that high. I think it would depend on the specialty of
Yeah.
physician you see. I also think, my biggest thing when I was first talking about CrossFit amongst my medical colleagues was to get people from telling people not to CrossFit to maybe them having a neutral opinion about it. And if I think maybe that you might have people, instead of telling you shouldn't CrossFit, it's dangerous, they might say, well, if that works for you, fine. And I think
And
that's progress.
that is progress, and
Yeah.
when you say 10 years ago in Boston, you were in a good area,
Yeah.
but because CrossFit was booming in that area,
Hmm.
Reebok was near that area, so it was a good
Right.
area to kind of begin. Now,
Hmm.
when you stop and think though, is it so much we're trying to get doctors to buy into CrossFit as far as the methodology, constantly varied functional movements at high intensity, or the nutrition component of meats, vegetables, nuts, seeds, some fruit, little starch, no sugar,
Yeah.
keep intake to levels that support exercise, not body fat. Just dropping some knowledge for
Yeah.
the listeners, right?
Yeah. So it's a complicated answer because, well, I'll say as a physician and at med school, so I was at Harvard Med School, the amount of
How hard
nutrition.
is that, by the way? Like, let's talk about that for a minute.
Yeah.
How hard is? I
Um,
mean,
Med
I think
school's not easy no matter where you are. I think it's challenging no matter where you are.
but
So
is
it's just a grind.
where'd you go to undergrad?
I was at actually New York University, but I was in their film and television production program. So I was not not med school bound at the time.
But
I
you went to,
worked.
I mean, NYU is, that's actually the school my father went to. So NYU is a great school as well. He
Yeah, I
became
was.
he became a dentist.
Oh yeah, I was in the film and television production program, so I wasn't even thinking about it at the time. So
How
I had to
did
go
you go
back to
from that? You had to go back to get all, I mean, you had to do
yeah.
organic chemistry at some
Yep,
point, right?
exactly. I had to go back. I ended up going back to doing it's called a post-baccalaureate program at Columbia University and doing all the
Oh my
sciences.
goodness. So you go from NYU to Columbia to
Yeah.
Harvard. I
So
get it.
yeah,
We get it, Amy.
so
You're
I
smart. You're
just
smart.
sometimes I can be, but um, yeah. So I had to go back to school, but I was working in television and stuff, and I was like, yeah, I think I need to do something better for the world. Sort of the short
That's a,
answer of it. So.
how old were you when you decided to do that?
Oof, I was, geez, 26 maybe?
So no, certainly not old, but I mean,
24, 20, no, maybe 23, 24, something like that.
you
Yeah.
basically had to do a reboot. I would assume
Yeah.
very few of your TV credits mattered,
Yeah,
right?
pretty much. Oh, yeah, it was starting from scratch all over again. Yeah.
So anyway, you were saying, I asked about the movement versus the nutrition.
Yeah, so it's a complicated answer because part of the CrossFit Health movement is also we discuss sort of the influences on the medical research and the guidelines that physicians are given on the influences that come from industry, from pharma, from specifically like the sugar industry, the Coca-Cola, things like that. And a lot of the guidelines we're given as physicians, or exercise guidelines, for example, are heavily influenced by these outside forces who may or may not have good science behind them. So as physicians, in medical school, we learn very little about nutrition, certainly nothing about movement at all. And then as professionals, we have to make these recommendations, and the best that we have sometimes are these guidelines that are shady at best sometimes. So
What's shady about them?
um, well, for example, something like um, our exercise guidelines are I was just at a sports medicine conference, and one of the main sponsors of this conference is Gatorade, the Gatorade Sports Science Institute, as it's called. But Gatorade is a Pepsi company, and they were presenting their science and their, why you should drink Gatorade at certain times. And to people who are all, well-intentioned, wanting to provide good care to people, and they don't necessarily realize who these guidelines are influenced by. And the thought is that the reason that these cola companies in particular have sort of cozied up to the people making the guidelines is to sort of divert attention away from their product as a cause of obesity to, look, you just don't exercise enough. Yeah, you can have your Coke, you can have anything in moderation, but you really should be doing is exercising. And I, as a physician, I don't feel comfortable with that influence being there.
Is it because I've kind of had this internal debate about what Coach Glassman,
Mm-hmm,
I'm all, I love everything that's going on in CrossFit period. And I know not
mm-hmm,
everybody agrees with me,
yeah,
but here's how I put it to them. We are not smart enough to understand what Coach Glassman is doing. That's really what it comes, the average
yeah,
person complaining,
yeah.
is not a multimillionaire, which I assume, I'm making a guess about Coach Glassman,
Yeah,
who's run a
yeah,
business. Like, it doesn't matter what you think, you're not a visionary. And maybe
right,
one day you will be, but currently, at least for CrossFit, you're not.
yeah.
So, but my thought is, does Coach Glassman hate soda or Gatorade, or is it the fact that they have this influence over science? Like, I don't think Coach Glassman's going to knock a Diet Coke out of your hand. Like, that
No,
in and of itself isn't the end of the world. It's the fact that these
yeah,
people are putting out false propaganda, if you will, trying to.
yeah, and that's killing people.
Right.
I mean,
Yeah.
at the end of the day, this stuff, it doesn't kill people instantly, it kills people over time. And what it's similar to is the tobacco industry, back in the 40s and 50s, who were they at the time they were marketing to physicians. And it took some pretty strong, undisputable evidence to then finally turn the tide on that. And Greg has said this as well. That's why he's not trying to railroad the tobacco industry, because they're not involved in the health space anymore. But Coca-Cola has, and sugar companies, they contribute money to big to big medical organizations. They influence research and guidelines within the health space, which of itself is pretty questionable. So I don't, it's not some, it's obviously it's a health hazard, but a lot of things are health. The alcohol is a health hazard. Tobacco is a health hazard, but those things don't have an area in the fitness space. They're not trying to
Right.
influence it directly anyway. So I think that sort of is what is is Greg's motivation, but I can't speak for him, but
Well,
that's,
yeah, and not
yeah.
just that they have an influence, they've lied about CrossFit and all that stuff as well, which
And
we've
yeah,
proven and won in court.
exactly. And that's the whole other thing, is a lot of the negative attitudes that exist in the medical sphere about CrossFit were based on BS data, essentially. And most people don't, and most physicians I talk to don't realize that. They don't know that. They know what the paper said. They know kind of what their friends have said. They know sort of what the media has said. And when you actually distill it down, the principles of CrossFit, constantly varied functional movements, perform at high intensity, those same principles are being used as injury prevention programs. They just kind of call it something else, and now it's an injury prevention program. So it's kind of interesting for me, I kind of sit in the middle of the two of the organizations and kind of have watched the evolution of it. I think Greg is a revolutionary. He's all about like knocking it down and building his own thing, and because of where I am in my career and have far less influence than he does, I sort of have to look at it from an evolutionary standpoint and sort of track it over time and try to educate people and kind of work from within the system to kind of get people to see the light, rather than just saying, well, screw you guys are wrong. So
Yeah,
I'm sort of, yeah.
not everyone can do
Yeah,
what he does and get
yeah,
away. Not
exactly.
that he's getting away with anything, but
Right, yeah. So it's sort of it's a fun place to be, in a sense, to kind of try to help educate people as much as I can, and spread the word.
have you had doctors that you truly look up to and respect, maybe at school that you learn from, or
Mm-hmm.
coworkers that are so obtuse or against CrossFit that it makes you lose respect?
I wouldn't say lose respect. Someone that I work with very closely right now.
You want to
Um,
give their name so everybody can know?
I'm not gonna disclose any names. So, when I first met this person, the statement they said to me was, all those CrossFit people are nuts. That guy who runs that company's nuts. Um, just so you know that. And I said, oh, I didn't tell him, oh, I know the guy, and I think Greg's nuts in a good way, but so I've, and this person happened to be a president of a very large organization that I think CrossFit kind of tried to go after directly. So he was sort of on the receiving end of it, and he wasn't happy about it. And this person is somebody who I respect a great deal, who's an excellent physician, who's someone who's helped me out a lot. But I know when it comes to the CrossFit word, we don't talk about it, because it's just not
It's like religion or politics.
exactly.
Yeah.
But it's being in the sports medicine space, it's you know it's sometimes kind of odd to not talk about it, but
Right. It's funny
gotta
because it is like religion and politics, except there is a definitive answer with this, where
right,
religion and politics, hey, you're entitled to your own opinion. It's kind of hard to accept someone's opinion when it's clearly wrong. And
right.
I know that sounds in and of itself
Yeah.
narrow-minded, but at the same time, I believe CrossFit works.
Yeah, and it's the same thing. So like people will say, the sort of amongst the sports medicine providers that I work with, it's like, oh, we see people get injured all the time, and it'll keep our clinics busy. And I've said this before, but I think when we have problems of fitness, people hurting their rotator cuff or like spraining something, rather than problems of illness like
Mhm.
diabetes and hypertension and all the stuff that comes along with that, like we're pretty lucky as a population at large if someone's rotator cuff is the biggest problem we have to worry about. So
That's a
that's
really good way to put it. I like that. Yeah, you may tweak your shoulder doing the kipping pull-up, but it's better than having type 2 diabetes.
Yeah.
That's it.
What's the alternative? Telling someone to sit on a couch?
Yeah, which we all know. We've all had
Yeah.
relatives that don't exercise and then
Yeah.
fall and break their hip.
Yeah.
So,
So
I mean, I tell people all that, like, today's Thursday, we're recording. I'm sore, I'm very sore, and I wouldn't want any other way. My back's a little tweaked from some deadlifts, and I know I'm gonna take a rest day and I'll feel better tomorrow. The alternative is not being able to pick up your grandkids in 20 years. I'll take this.
yeah, I
Now,
mean,
so you went to Harvard, or you went back to school, I should say,
yeah,
24, 25. Did you
something like
feel
that.
this way already? Was this in your belief system, or is this something that developed in your time at school?
So when I first went back to school, I hadn't found CrossFit yet. When I started med school, so that was 2009
So you
ish.
started at Harvard in 2009?
2009, yeah, and that's when I first really, just as a person, started thinking about my own diet, my own health. Because as a physician, you're
Close to
supposed to be.
30, putting on some,
Yeah,
easy to
yeah.
packing pounds.
I think at that time I was maybe 25 when I started med school. That's what it was. I was 25 when I started med school.
Okay.
But I hadn't really kind of looked at myself, and because I had been an athlete my whole life, but I never really focused on the fitness part of it. I was just like, can I do the sport that I'm doing? And I really started kind of looking at myself and saying, okay. So I started running a lot, and I was bored by that. You play team sports your whole life, and then you hit a certain age and everyone's like, all right, get on the treadmill. This is it.
Yeah.
And it's like, for me, it was not fun. I was getting a lot of like little ticky-tack overuse injuries. I just wasn't loving it. And then very close to where Harvard Med School is, was the original CrossFit Fenway. And I
Oh,
would
yeah.
pass it.
Yeah,
I'd pass
I've
it.
been there.
And one day I said, I'm gonna try that. That looks like fun.
And
And I never looked back.
and,
So,
and right away, did you think to yourself, this is going to influence how I practice medicine?
yeah, so it ties in really well. And I found these sort of two things sort of at the same time. But my primary specialty is called physical medicine and rehabilitation, or PM&R, or physiatry. It's called a lot of things, but it's a very small field of medicine that most people don't know about.
So what does it do? What's your primary scope or focus?
So essentially we're doctors of function. And we focus on the physical manifestations of disease processes, whatever those are, and looking at injuries, whether they're permanent injuries like spinal cord injuries, traumatic brain injuries, or like temporary things like a sports injury. And we treat sort of the physical problems associated with the disease. So say you have cancer, I'm not the person who's prescribing the chemo and figuring out how to beat the cancer, but I'm the person who thinks about, okay, how are you going to get up and get to the bathroom? How are the side effects of the chemo affecting your quality of life? Things like that, which it's a fortunate position for me to be in, to be able to think about those things, to improve people's function and daily life. I mean, at the time that I really started looking into it was right around the time of the Boston Marathon bombings had just happened.
So maybe like 5 years ago.
Yeah, and I was involved in the treatment of a lot of people who lost limbs during that, and helping improve their function as new amputees and getting them involved in sports and things like that. And the goals of physiatry and the goals of what CrossFit are in many ways identical. And I thought the two complemented each other so well, but one didn't know about the other. And on like all my social media profiles, the little phrase I use is explaining CrossFit to physiatrists and physiatry to CrossFitters. They're very similar, but they usually don't know about each other, and they should.
Have you worked with some of the adaptive athletes I've had
Yeah.
Kevin Ogar and Steph Hammerman and Stouty and Logan on. Have you worked with them at all in the adaptive course, or?
So I'm hoping to take the adaptive course, and we're actually trying to organize one up here. I don't know what the status of that is, but I've met Kevin Ogar. We've chatted about it because he actually has worked with physiatrists out over at Craig Rehabilitation.
Yeah.
And so he's very aware of the field as someone who has a spinal cord injury. So he's been a great resource and sort of figuring out how we can bring these things together or get things going in parallel. But I would like to take the adaptive course, once I find a course that lines up with my schedule. That'd be
And
pretty cool.
when you say out here, you're in Maine, is that correct?
For another couple of weeks. Yeah, I'm sort of in flux right now. I'll actually be in New York starting in July.
Where are you
So
going to be in New York?
I will be as part of Northwell Health System, and they sort of cover Queens, Long Island area.
Wow, very cool.
But I'll be working with their Department of Orthopedics and PM&R over there.
Well, you'll have to let me know because I know some great boxes out in that area. But do you know
Sweet.
my friend Josh Murphy? Yes, you're at Casco.
Oh yeah. He's awesome. He's great.
Now, here's a great example, and I don't want to throw Josh under the bus, and I hope he's listening to this. But
Yeah.
Josh Murphy needs to lose a good 70 pounds. Now you have someone. You're smirking.
I'm not saying anything.
You're not. Don't say anything. Okay.
I like Josh a lot.
I love Josh, and now I helped his brother lose over 100 pounds. I don't know if you know his brother.
I don't know him.
He lost over 100 pounds. He's in my new book. His name. We call him Murph, but he came in at about 500. He probably lost 200 something pounds. But anyway, from a coach's perspective, let's take it like this. You're a doctor. You have someone, let's call him Josh. We're speaking generally, right?
Oh, that's cold, man.
Who understands CrossFit. They're willing to work hard. Now we know it's your nutrition. Coach Glassman used to say, I don't ask you how your nutrition is to find out how your nutrition is. I ask to find out if you're going to lie to me because I know what your nutrition looks like by looking at you. How can a coach, this is a podcast about coaching. How can a coach help that person?
So if you were talking about somebody who's already made that step to say, I want to change this.
Yeah, every box has this person. Every box has.
That is key because I think as physicians we don't really see those people a lot.
Right, you get them
coaches.
Too late. Yeah, you get
as
them.
Coaches. Yeah, as coaches, they've already made that step that they're willing to try something. And we can, as physicians, we can refer people or make recommendations to people, but the real lifestyle change happens when those things become habits. And that's where the box comes in. That's where the habits can be formed. And I think what makes CrossFit in particular such an effective tool in making those lifestyle changes into habits is the use of community and a supportive environment with other people going through the same thing and cheering each other on. I think that is the key. And as well as coaches who seem invested in that person's success. It can be intimidating walking into a box with, a bunch of chiseled people. But if that coach shows, takes joy in someone's success, however small it is, that could be very effective as well. I know. So I just finished a nutrition program here in Casco Bay. It's led by great coach Emily Hanley and Nick Beal, and there's a little Facebook group involved, and everyone's sharing recipes, and everyone's checking in with each other, and it's accountability. It's weekly check-ins with data points that you can track, and a plan, a very specific plan. I think it's like what we do as physicians, we say go lose weight, and we don't give any kind of formal plan other than these kind of vague guidelines, which in and of themselves are influenced by things sometimes that are not great, and people walk out of our office and say okay. Whereas if they can show up at a box and someone says, here's the things you need to eat every day, eat exactly this much of that, and I'm going to check in next week to see, we're going to hold you accountable to that. And then here's a bunch of people who give you ideas for other things to eat. I think that's a super effective tool that's very much underutilized, certainly in the medical space.
But that's a great point. At the box space, you really need to create this accountability. And I was joking about Josh, but every box has those people that are diehards for CrossFit. The hour at the box is the fun part. The challenging part of the other 23 and eating healthy.
Yeah.
but that's really where you can make the greatest impact on someone's life.
Yeah.
The old quote of, I have an hour to help you, but you have 23 hours to mess that up.
Right.
And we see that a
Yeah.
lot. Do you find it easier for you as a doctor and so invested in this, CrossFit health and this push and pursuit of it to eat healthier? Or do you still find there are times when you're
Yeah.
like, I want a drink or I want to have a
Sure.
snack?
Yeah. So I think part of it is the mixed messages, right? As physicians, like I said, we don't really learn very much, and the stuff we do learn sometimes has the influence. It doesn't. They're not very clear or very specific, the guidelines we get. And then even in the media, as someone who kind of can understand the literature behind it, you can, if you want to eat a certain way, you can find literature that supports that, regardless of whatever it is. So if you want to
Sure.
eat nothing but candy, I'm sure there's a paper somewhere that will say that that's the way to go. And myself, the way I've been figuring it out as far as what to recommend to people is experimenting with myself. So back when I first started med school, I was trying out being a vegan, just to see. There was a lot of convincing literature about that. And then when I started crossfitting full time, it didn't really, I wasn't seeing the performance, my performance doing all that well. So I started incorporating more meat. And then I know a lot of people who are keto and who have great results from that. It's a little hard for me to stick to that, but I see the value in it. And then I recently, when I did this nutrition program at my local gym here at CrossFit Casco Bay, I started the whole macro counting and tracking that way. And that's really what's worked for me. So, through experimentation is how I've sort of come to what works best for me and what I would feel comfortable recommending to somebody. But
And I had Nicole Coyne on recently from Healthy Steps Nutrition, and we dove into both of those lifestyles, veganism and keto. And she
Mhm.
basically had the same things to say about it, which I agree with. That's, find out why your members are doing that. So many
Mhm.
people these days, the buzzword is keto. And I think really what they're associating with that is weight loss. But
Yeah.
there's more sustainable and fun ways to lose weight, such as
Mhm.
tracking your macros, that, big big takeaways, it can last forever and build those habits. And
Yeah.
with that being said, so Coach Glassman, off the couch, off the carbs,
Mhm.
that I believe is also a statement that gets misunderstood.
Yeah.
I don't think he's telling people you cannot have carbs. When he's
Mhm.
referring to carbs, he's referring to processed carbs, and even more specifically sugar and
Mhm.
sodas. But people take it and, like, because my message a lot of the time is, have some foods you enjoy. I'm a
Yeah.
big, people know that I will eat a donut, I will have pizza. Last night I had Chipotle, but it's within
Hells yeah.
reason, and it's, I track my macros. So people like, aren't you against what Coach Glassman's saying? No, those are not the people that track their Chipotle are not the problems. They're not the people developing chronic disease. It's
Right.
those that are eating Chipotle, the side of chips and guac, and then refilling their large soda 3 times.
Right. Right. And that's, I think, I know as far as the CrossFit health meetings that we have, there is a lot emphasis on nutritional ketosis and the research behind that as a way of treating cancer, as a way of curing chronic disease. And I think for people who are so far kind of in a diabetic state, it's been shown to be a very effective way of rapid weight loss, blood sugar control, etc. Um, but I think the general message of off the carbs, off the couch, off the carbs is that exactly that. Like you have to start with eliminating the soda, eliminating the junk food, eliminating the processed crap that you're eating, and then you sort of, after you've peeled away those layers, then you can start like thinking about the nitty gritty of, do you want to macro count? Do you want to, what are your goals in this? Is it performance? Is it just, maintaining a healthy lifestyle, etc. But yeah.
So, what is one way box owners can help this? What can we
Yeah.
do from a box level?
Yeah. So there are a few things that I think could be important. And one is identifying a person in your constituency, if you will, that can be a point of contact with the health system, the healthcare
Meaning,
system, whatever that is in your neighborhood.
but meaning most likely some sort of doctor.
Yeah, but also a good resource for box owners is looking into the rehab community, not just the MDs, the physiatrists, but also physical therapists, occupational therapists, because they really focus on function as well, and they will often treat someone as an inpatient, and they'll need some kind of further exercise plan going forward that they can't necessarily provide, at that high level, or insurance doesn't cover it or whatever, and they can be a good referral source for box owners. But finding that person in your community who can be a point of contact with the healthcare system and brainstorming with them as the best ways to sort of interact with the medical community, setting up a referral source or holding classes or fundraisers, getting involved in things like fall prevention and elderly people. It's a huge problem, and it's a huge healthcare expenditure, and people are looking for ways to help combat that. So setting up some kind of free class or some kind of senior thing, contacting the local diabetic care centers or primary care community centers, and working with them as for diabetes and nutrition counseling. Because I think, I'm not a primary care doctor, but I know a lot of them, and they're overwhelmed. They have 15 minutes to talk to somebody and figure out all their chronic diseases and make recommendations, and they get sent on their way, and they're looking for somebody who's interested in taking these people on to help improve their health. So, or give them a plan, because like I said, we're not really educated how to do that. So I think that's important, and I think it's important to find that person, to make the connection with someone in your box who can help you. Because I like when I came up here, the people who were in this box were super excited and seemed really engaged in trying to figure out how I could help them, how they could help me figure out something to work in the health space. I know a guy up in near Killington, Vermont, who's super excited at CrossFit Rising Star, who's super interested in, getting stuff started. And I've been in other places where they're not really seemingly interested or even know that I'm a physician, or, so it's one of those things where making those connections within the box to then try to help reach the community in different ways.
So, the other question we get though is a lot of doctors, every box that is lucky enough to have a doctor, be it an MD, a PT, wants to get involved in CrossFit Health, or maybe take the seminar that you guys, it seems like, are only in aromas at the time. I know the goal is to expand them. How can they find out more about that?
Yeah, so it's a little bit tricky now with the whole departure of CrossFit from Facebook, but we have a CrossFit physicians group on Facebook, and that's how we originally all sort of connected with each other. I think if you want to be part of that, I still think it's the best way to help get connected within the movement.
So that's still on Facebook somewhere. There's a doctor group.
Yeah, it's CrossFit Physicians. I don't know who officially. I think it's now we're sort of moderating it ourselves, but there are people who sort of interact with HQ who may check in time to time on it.
So if you're a doctor listening, or if you have a doctor, because I get emails about that, like, hey, I heard about this, how do I get involved? And I didn't know. So maybe seek that out. And then also they can check out the CrossFit Health website.
Yes. I don't know if the CrossFit Health website necessarily has information about how to get involved. I haven't looked at it recently. Certainly people can reach out to me on social media. It's at Amy West MD. If someone wants to, I could connect people to other people. And that's what it's been about. It's been sort of like this grassroots movement, and people sort of talking to other people, and then that person emails that one, and it's still sort of in its infancy as far as getting like very formally organized.
Well, that's what they said about CrossFit in 2001. So
right. Yeah.
I think we're moving in the right direction. I do want to ask about this. I mentioned, you were going to be on here, and a couple of people reached out, and they say there are people that are kind of turned off to some extent about what CrossFit's putting out there, especially on .com. Not so much the workouts, but the images. It's like, oh, it's all old people now. How are we going to get the people that want to do it?
Hmm.
And I've kind of spoken my piece about it, but I'd like to hear your thoughts on that, especially as it
Yeah.
pertains to the affiliate level.
Yeah. So, I mean, I actually spoke about this with someone from HQ about the sort of the almost like, it's not necessarily rebranding, but the sort of the imaging that we're seeing now. And person said, well, yeah, we're putting people in our media that 10 years ago we would have been embarrassed to put on the front page of something, that was a CrossFit brand, CrossFit branded thing. And the goal in that is to show exactly, that this is for everyone. It's not just for the rich Fronings of the world. And I think, wow, we're going to have the greatest impact is through reaching the people who are morbidly obese, the person who's 80 years old. That's the way that we have a large impact on the health space. And I think at the end of the day, that's one of the goals of CrossFit, is to make people healthier, move better, be more functional, have a better quality of life long term. So I think that's sort of where the shift in sort of the public imaging has gone. I mean, I that is what I take from it. I can't really speak exactly for them, but what they're thinking. But that's the sense I got.
Well, no, and I agree with you. And my philosophy is people are afraid of CrossFit to this day, and
Exactly.
most likely if you're listening, you understand why that happens, but that it shouldn't happen. In other words, anyone can do it, but it's intimidating. So,
Yeah.
so what that's doing is saying, hey, anyone can do this. You can do it in your house. We recommend, for me, when I want to learn something, I seek out a professional and I try to learn from the best. So if
Mm-hmm.
someone stumbles upon CrossFit.com and they see the old guy or old lady doing,
Mm-hmm.
water jug deadlifts, they think, well, where can I do this in town? I want to learn. And they do find the box. So you are going to get those people, but you're still going to get, look, the games are still going to be on at some point. Like,
Yeah.
no one's going to be like, oh, CrossFit doesn't get you in shape. You'll still get the crazies and the fanatics and the young people that want to come and get in the best shape of their life. But this is for the affiliates only doing more so to open the door to everybody.
Oh, sure. And now, even like as a physician, I can say go on CrossFit.com, the at home section, and look up some exercises there. Like, and that's a super useful tool for me. It's a helpful tool for physical therapists, who I can say, before I could say, oh, it's for everyone. Even older people can do it. You don't have to be in shape. And if everything that someone sees is these elite athletes, they go, yeah, okay, sure. So now at least I can point to some things, and you say, you see, this is something you can do also. So I think for the boxes, it's certainly a great tool to help them reach people who might be afraid to try it, and in the medical community to tell people this is not just for people who are already in shape.
What's one thing you used to believe when it came to medicine or nutrition that you no longer believe is true?
Ooh, that's a good one. Um, One thing that I used to believe, I think and I think this is something that applies to a lot of physicians, maybe not just me. It's almost being a little naive to the idea that, the evidence you read is legit, or is maybe not, is not does not have influences behind it that are maybe not the best in with the best intentions, so you would, in when I first started med schools, it's we all try to practice evidence-based medicine, and looking at the literature, finding recommendations based on that, and pointing people to to studies to sort of back up like what we think, and through this process, but also just my own kind of digging around, you realize, oh, maybe that data isn't, in some cases, isn't as good as you think it is. Maybe the 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 funding behind that study influenced it in some way, and the stuff certainly that makes it to the media, the general media, it's sometimes way, way, way off, or, you know, it's a very small part of whatever it is they're talking about is what they're choosing to highlight. So, yeah, I think in general, for the most part, everyone's very well intentioned, but I think there are a lot of things at play sometimes that we don't realize as physicians that can influence us, and we're not even, sometimes even aware of it.
Yeah, no different than your nutrition. You know, we all have our beliefs primarily because what our parents told us and the commercials we watched, you know, when we were 13.
Yeah.
What's one book you recommend all the listeners check out?
Ooh, that's a good one. Books. So.
And ideally not a Harvard textbook.
Yeah, no, I haven't. Yeah, I'm not going to recommend one of those. They're not exactly fun reading. Oh, wow, that's a good question. I was one book that I read was interesting was called Bad Pharma. Trying to remember the author of that. I don't remember off the top of my head, but that was actually a book that I found sort of through
Goldacre.
Yeah, that sounds right. Yep.
Google search.
That's good. I also enjoy, you know, it's sort of an interesting look at the data that comes out about some of the pharmaceutical company stuff, which is interesting. That's a good one. Also, I enjoy, you know, any books about kind of good movement, you know, Kelly Starrett stuff and things like that.
Yeah, you can't go wrong with Supple Leopard.
Yeah, exactly.
It's been great really diving into this. I feel like having you, you know, and your expertise on here, there's even more to talk about. But is there, you know, we've only scratched the surface. Is there anything else, you know, that the listeners should take from this, think about? You know, it's a lot of coaches, a lot of box owners, a lot of just people that do CrossFit about what they can do. I mean, you know, when we give the nutrition lecture at level ones, 70% of, you know, the world's going to, you know, Western society is going to develop chronic disease.
Yeah.
You know, 80% of medical costs are going to fight these things. The average American eats 156 pounds of added sugar every day. All things that are important to know, but anything else you think they should take from this, they can implement, you know, other than, like you've said a couple of times, and I say, lead from the forefront, lead by example.
A couple things. I think one is, you know, so something that I work a lot with is people with pain, like back pain, chronic pain. And I think sometimes that condition gets, in the talk of chronic disease, the chronic back pain, chronic pains, people sometimes sort of get sort of left out of that discussion, and we're focusing on diabetes and obesity. But I would argue that most people with bad diabetes and who are obese have back pain as well. That's another thing on their list. And I think good movement and getting people moving again and feeling comfortable with movement is a way to also is a way to augment the health of that population as well, the pain population. And I think that's also a way for CrossFit coaches and boxers to sort of connect with the medical communities, is by saying, you know, this is also an effective tool for treating that condition as well. And another thing, I think one way that CrossFit is super effective. So like I was saying before, I was someone who really liked to move, and I was going to these Globo gyms and was bored out of my mind. But you know, going to CrossFit every day and having someone tell me what to do, exactly when to do it, how many times to do it, and it was very helpful in me sort of getting on track. Same thing with nutrition. So I think having definite plans for people to follow. So this way it's very hard for them to kind of wander off if you sort of have very definite, explicit plans, whether that be for nutrition or for movement, whatever. I think that's a super helpful tool, because as physicians, we kind of can't provide that. We don't have the education to provide it, or the time. And that's the biggest problem, is we really don't have the time to delve into it. So I think that's really where CrossFit boxes sort of can continue that journey.
That piggybacks off of a recent podcast that I did with the co-host Fern about programming, and it's, Most people are not at your box to have 3 parts and to be shuffled around from strength to metcon to this to that. They're there to learn, and the last thing they want to do is think. They've been at work 8 hours, or they're dealing with kids, or whatever's
Mhm.
going on. They want to come in and be told what to do, and
Exactly.
do it well and do it safely. And if
Yeah.
you're doing too much in that hour, this is what you don't have the opportunity to do: to interact with the members, to drop some nutrition knowledge here
Mhm.
and there, to coach them, to make sure they do deadlift better so they are out of pain when they're doing it.
Yeah.
That's most of us that opened a box did not do it to take the average person to the CrossFit Games. We did it to impact
Exactly.
the average person's life. And
Mhm.
and most people that come in, if you stop, if you're listening and really reflect on your membership base, it's the people that want to play with their kids, their grandkids, get rid of their dad bod, get rid of the weight they, when they were pregnant,
Yeah.
and live a happier, healthy, more balanced life. And I think, you nailed it with that. And we have this privilege and honor to do it because of Coach Glassman and because of CrossFit. And it's why I get so frustrated when I see people upset with the direction. It's like, if you just stopped and took a broader, wider lens view, you'd realize how much more this will actually allow us to impact people.
Yeah, and I think one thing we've learned is, and I think this happens to everyone when they first join CrossFit, is that you think you're in good shape, you think you're doing healthy things, and then you realize, wow, I'm really not.
Yeah.
And there's a great movie called That Sugar Film. I don't know if you've seen it.
Yeah, I have seen it. Yeah. Is
Yeah,
that the one
so
with the
like,
guy who lost his teeth with Mountain Dew?
yeah.
Oh my
But
goodness. Yeah.
but the way that the way that the guy sort of goes about eating sugar in his day is he doesn't eat anything sweet. He eats all these things that are supposed to be healthy, or at least not sweet or sugary, and they all have hidden sugars in it. And he, it's, I think the average person, even someone who thinks, is not, they think they're being healthy, and there's all these hidden sugars in it. And same thing with exercising. People go to a regular gym and they get on a treadmill for an hour or whatever, and they think, oh, I'm fit now. And there's obviously a lot of holes in that. And
It's
CrossFit's a great way to expose that.
and it's a great point, because we go. I think if you're listening, you've probably been the guy who laughs at people doing curls in an hour on the treadmill. It's like, no one hops on that treadmill for fun. They're doing it because they think they're doing the right thing.
Yeah.
And so it's
And,
our job to educate them.
yeah. And the social piece of it is so huge, knowing that I'm going to see certain people every day and talk to them, knowing that they're going to ask me where I was when I'm not there. Things like that are huge in affecting lifestyle change and forming those habits.
Absolutely. I met my wife through CrossFit. We had, like I said, Nicole a coin from Healthy Steps met her husband through CrossFit, and I'm sure most of the guests have met, if not their significant other, they're some of their closest friends. So
Yeah.
it's really awesome, and it's awesome to talk to you about this. And again, I'll put your information out there, but if you're just listening, at Amy West MD on Instagram, you can always reach out to her if
Hmm.
you know somebody that wants to get involved from the health aspect. And then, we'll put out other ways to get in touch with you. But I
Sure.
really appreciate you being on, Amy. It's been great.
Thanks. I enjoyed this a lot. So happy to
I'm glad we
take
got
my
your
pains at any time.
I'm glad we got your headphones working.
Yeah, that's great.
Thanks for listening to Best Hour of Their Day. If you haven't heard about Anchor, it's the easiest way to make a podcast. Let me explain. First of all, it's free. How cool is that? There's a creation tool that allows you to record and edit your podcast right from your phone or computer, so it becomes super simple. Some of these episodes with Fern or Todd or myself chatting with one another, we've done right within the app itself. Anchor will make it easy to distribute your podcast to all platforms: Spotify, Apple, and many more. And you can make money from your podcast with no minimum listenership. It's everything you need to make an awesome podcast in one place. All you have to do is download the free Anchor app or go to anchor.fm to get started today. Come on, who doesn't have Spotify at this point? And if you were unaware, Spotify now is offering podcasts. That's right. On Spotify, you can listen to all your favorite artists, but also podcasts in one place for free. Spotify has a huge catalog of podcasts on every topic, including the one you're listening to right now, Best Hour of Their Day. On Spotify, you can follow your favorite podcasts so you never miss an episode. Premium users can even download episodes to listen to offline wherever you are, something I always do before I hop on a plane. And you can even easily share what you're listening to with your friends on Instagram and other social media platforms. Here's the deal. If you haven't done so already, be sure to download the Spotify app, search for Best Hour of Their Day on Spotify, or browse some other podcasts if you want. You can find them in your library tab. And also make sure to follow me so you never miss an episode of Best Hour of Their Day. Thanks again for listening to Best Hour of Their Day. We hope you enjoyed this episode. And if you did, one more time, please leave us a review on Apple Podcast and send us any feedback you have to @besthouroftheirday on Instagram and besthouroftheirday@gmail.com if you want to shoot us an email. We appreciate you. Thanks again. Have a great rest of your day.